Dr. Chi is that rare professional who brings with him not only the skills of an outstanding restorative dentist, but also the skills of a trained and experienced dental technician. He's doing the 4th in his series on Crown and Bridge and talking about delivering the crown and the very popular topic of cementing versus bonding.
And this is part 4 in our Crown and Bridge series on cementing versus bonding. This is a topic that comes up almost every time I lecture. I've met dentists from around the country, still kind of confused as to which methods and routes to take, what primers to use, which cements to use in which situations. So I'm going to see if we can try to simplify this process and what I've had great success with so far. So if we take a look at the different types of cements, we hear bonding, we hear cementation, conventional cementation, there's self-etch, self-adhesive. It can be extremely confusing. So let's see if we can break down these main categories of cements. If we look, I chose Ivoclar, Cours, and 3M, 3 really popular brands and reliable systems on the market, and I'll have an example of each type. So if we start off with conventional cements, and the most popular conventional cement type available today are resin modified glass ionomers, or RMGIs. This is a very straightforward delivery system that you have a hand mix and auto mix types, a clicker type where you can mix it on the pad. But essentially, all you have to do is load the restoration and seat the restoration down, and you're relying on a retentive frictional retention for your restoration. So it's a simplified process, but the preparation does have to have more of a retentive and retention form, a taller preparation for this type of cement. And I'll break this down even further in the coming slides. The next category, these are more advanced cements. They came out more recently. These are self-adhesive cements in an attempt to make or create increased bond strength to the tooth structure. So this is more of a resin-based system. So this is kind of jumping into the bonding category. We're shifting a little bit away from the conventional cement. But these self-adhesive resins, they do have components within them that it's a little bit more acidic, where it will etch a little bit of the tooth structure to create more of a micromechanical retention on the preparation. But it's still heavily leaning on the greater mechanical retention and frictional retention, similar to conventional cements. And then we move on to the category on the right. And these are meant to create and establish the highest bond chemically, micromechanically, to the tooth structure. Starting at the top, we have NX3 from Cours, 3M's Relax Ultimate, and Multi-Link Automix from Ivoclar. These are just a few examples. Again, it's just Ivoclar, 3M, and Cours. And these are just the cements. I chose these because I have the most experience using these manufacturers' cements and these different types. Now, if you look at the row or the column on the right-hand side, you'll see that not only do you have the syringe, the dispenser for the cement, but there's also some bottles that go with them. Because these are the adhesive systems, you have a separate adhesive layer that needs to be applied to the tooth structure. Now, whether it's a single bottle or 2-bottle system, it really depends on which generation the manufacturer decided to go with. And we don't have enough time to really dive into the generations, but it essentially means you're using a lower viscosity bonding agent to apply to the tooth structure in order to try to create deeper resin tags into the tooth structure for a more strong bond to the tooth. Now, we could essentially think of self-adhesive cements as the same as adhesive cements if you add in an adhesive or a bonding agent to them. Of course, the manufacturers are not saying you have to use them, because the self-adhesive resin cements are meant to be used on their own. But a lot of studies out there show that the application, the additional application of a bonding agent to a self-adhesive cement takes it up to about the same bond strength levels as the adhesive systems. Now, if we take a look and dive into the properties of these different categories, we'll see that if you're seeking higher bond strength, better mechanical properties, just a stronger substance in that cement, and certainly more technique sensitivity and a more aesthetic cement, you're going to lean more toward the right-hand side with the adhesive resins. Think of these like composites. Composites are going to be your more aesthetic, stronger, and you're trying to establish a bond between the restoration and the tooth. Now, some benefits to a conventional cement like an RMGI or a standard glass ionomer cement, they are a bit more moisture tolerant. And thinking about the future, if you have to remove the restoration, it typically will be much easier to remove if you use a conventional cement. I'm sure we've all experienced bonded restorations. It can be quite a chore to remove and prep those old restorations off that are bonded. And that really shows you the benefits to that if you're seeking that higher bond strength, because now you're relying on that micromechanical retention. I'm going to take you through kind of my thought process. We essentially, for Crown and Bridge, work on full coverage and partial coverage types of restoration. So if you're confused, we can start off with what type of restoration are you restoring or delivering for your patient. So starting off with full coverage cases, full coverage crowns and bridges. We're going to divide that into different material types. So starting off in the top area here, we have our stronger full coverage materials. We have zirconia that could be both monolithic and layered zirconia, because the zirconia core is a very strong core, or alloy restorations or gold restorations. So in this stronger category, from there, think about your preparation. Do you have a taller preparation with that retention and resistance form? If that's the case, then you can rely on that frictional retention that a conventional cement, or even a self-adhesive, a more simplified cement where you simply just load the restoration and it has that chemistry to try to adhere to the restoration and also the tooth structure itself. But again, overall, it's relying on the retentive form of your preparation. In a non-retentive situation, you would then move on to an adhesive situation where you're relying on the chemistry to bond and link the cement to the material, the restorative material that you plan on using, and also the tooth structure. On the bottom area here, if we look at the quote unquote more weaker materials, your glass ceramics, this would be like Emax, Empress, Obsidian, your lithium silicates, disilicates, and your composite resin hybrid materials. With these weaker materials, you're really wanting to move toward an adhesive system because using that adhesive system, you're going to rely on that micromechanical retention and the stronger mechanical properties of that cement to increase the strength of that restoration. Now, if we look at partial coverage cases, it's going to be very, very similar. So partial coverage, inlays and onlays, and veneers. If we look at the stronger category, so if we're moving toward the oxide-based ceramics or even alloys, if you're still using gold for inlays and onlays, it's a great restorative material. Then you have to look at your preparation. If you decide to use that type of material, do you have a lot more retention? If you have a retentive prep, a deeper prep, then you can opt to use, similar to the full coverage cases, a resin modified glass ionomer or that conventional category, or it's self-adhesive resin cement where you're relying on that retentive frictional retention. In a non-retentive situation, you want to rely on adhesion. And the same applies for, again, those weaker restorations. So I'm going to take you through what these processes look like. So I'm going to show you a full coverage cementation with resin modified glass ionomer on a couple Bruxer full coverage materials. So here in this case, I'm using 3M's Rely Exuding Plus. This material is very simple. You simply load it into the restoration. Great isolation is still very important, but again, these materials are a bit more moisture tolerant. So you do want to use these ideally in those situations where the patient has a lot of heavy saliva, and it can be very challenging to isolate in those areas in the posterior. So here we're working on 18 and 19. We load both restorations. There were no primers. Nothing was actually applied to the tooth in this situation because these teeth were endodontically treated. On vital teeth, I do like to use a desensitizing agent, and I'll show you kind of what my step-by-step process is for each situation. These materials do have a tack cure option where you can light it for a few seconds. This is again the 3M Rely Exuding Plus, where it makes the cleanup much easier. And here interproximally, you saw using a floss with a knot tied into it. You do want to try to use that interproximally. But what I would caution here, if you are using a conventional cement with a PFM, or a really thick monolithic zirconia restoration, you have to consider that there is very little light penetration, certainly no light penetration through a PFM at all because of that metal substructure. So you should rely on the self-curing ability of that cement before you really go after cleaning that restoration. Because I have had a couple instances where I rushed the cleaning with the floss and I did pop the restorations off. So you want to wait about that 2 to 3 minutes before the restoration will gel to begin cleaning, and then really, again, wait for that set time. And usually these materials, the conventional cements, resin modified glass ionomers or glass ionomers, will fully set in about 5 minutes. So now on to the next situation. So for a less retentive preparation, I'm going to take you through this case here. We have our patient Rosie. You can see here she presented with a lot of wear on her anterior teeth. So we treatment planned 10 veneers for her. And because of the heavy wear, we decided to use a zirconia partial coverage veneer. So these are Bruxer Aesthetic. It's a higher yttria content zirconia, and it's engineered for the anterior region for a great combination of strength and aesthetics, but we do need to bond this in because we do not have that overall mechanical retention. And so we are planning to use an aesthetic resin cement. You can see how happy she is. We place a try-in paste. A lot of the aesthetic resin cements have a try-in paste where you can evaluate the overall aesthetics of the restoration, and it will match the color of that cement. And for these restorations, I always use a total etch approach. So that means etching the entire tooth preparation, both enamel and dentin. So using phosphoric acid for about 20 to 30 seconds on enamel, about 5 to 10 seconds on dentin. And I do apply a desensitizer to the teeth after the etch. Desensitizer, I use a Gluma. I let that soak for about a minute, and then I do apply a bonding agent. You can see after the bonding agent application, we do light cure. Now, for the restorations, this is typically done before the application of the etch and the desensitizer and bonding agent on the teeth. But here I'm just showing a couple ways that you can clean these restorations out. Again, this is zirconia. If you are bonding zirconia, after you try these in, it's really important to decontaminate the material, either using air abrasion or IvaClean that you saw, that purple solution. Once you decontaminate and clean those materials, then we apply Monobond Plus, which has the MDP monomer within it. That's a phosphate monomer that will help adhere and bond to zirconia restorations. And then in this case, I'm using Cours NX3 cement. They're aesthetic resin cement, and this is a light cure cement. I like using light cure cements for these partial coverage anteriors because I can see all of the restorations down together, and I'm not having to rush. If you use a self-cure or dual cure cement, you're kind of racing against time, and at some point that cement is going to harden on you. And if at any point, if you need to reposition those restorations, you're stuck. So I highly recommend using a light cured resin for these type of situations. And here I'm just seating all the restorations down. I usually start from the midline back, working on the centrals. that's so critical to get that alignment first, and then we'll work our way back. And here I'm using a couple of bite sticks on the facial and incisal to really ensure good seating. And here you can see our curing light here has a 2mm tip. And that 2mm tip helps me cure the restoration in the very center. And then we can tack cure around the restoration, around the margins, to begin the cleanup process. I like to do that to try to lock those restorations in the very middle, and then take our time to tack cure, to reach that right tack cure for the ease of removal. Because with resin cements, it can be very, very challenging to remove excess cement if that begins to fully cure. And once things are fully set, then we begin our checking of the occlusion. So you can see how beautiful these restorations are. These are monolithic zirconia. This is Bruxer aesthetic. And for these materials, you do need to ensure that you follow the bonding protocol very, very closely, so that you can have these type of results and certainly improve and change the lives of our patients. It's just a look at the final results of these Bruxer aesthetic veneers from 4 through 13. Okay, so a recap of what we just did. So bonding Bruxer. So we need to ensure that on the restoration, the lab will usually air abrade and sandblast the restorations for you. So you really need to check. If you're not sure, please check with your lab to see that whether or not they are air abrading it. Typically, we're going to air abrade those restorations with 50 micron aluminum oxide. And if they do that for you, that essentially roughens the internal surface. So zirconia restorations do not etch normally like a glass ceramic with hydrofluoric acid, so that it's the air abrasion that will create that internal roughness. If they don't air abrade it for you, having a chair-side air abrasion unit in your office is also a really nice addition for your bonding procedures. Here at Glidewell, we do air abrade every restoration before it's sent back to the clinician. After you try in the material, as you saw, we have to decontaminate the material. If we are bonding, you have to decontaminate using one of these 3 methods. You can air abrade again, or use Ivoclean, which is this solution right here, or sodium hypochlorite. So these 3 methods can effectively clean the surface of the restoration to allow for the primer, the zirconia primer, to adhere. Once you have a clean surface, then you're going to apply a zirconia primer. These are just a couple of examples: Z Prime by Bisco and Monobond Plus. These contain the MDP primer. That P is a phosphate monomer, and the phosphate will adhere to the zirconia to ensure that you can create that bond, that chemical bond to the material. On the tooth side, what you just saw, I typically will follow a total etch technique. After we etch, then I do rinse and dry. Of course, we do want to check the enamel for that frosted appearance. And sometimes through that process, we could desiccate the tooth. And if we dry the tooth out, whenever we're bonding, it's super important that we have a moist dentin surface, because if we over dry the dentin, the bond strengths will significantly decrease. So in order to re-wet the dentin after we may have dried the tooth, I like to apply a desensitizer. A desensitizer will also act similar to a primer in a 2-bottle bonding system. The glutaraldehyde and the HEMA solution within it does re-wet the tooth, it rehydrates the tooth, and it creates a great bond surface on the dentin for the next layer of the bonding agent. And so depending on your system, you may have a 2-bottle bonding agent system with a primer and bond, or a single bottle, but this is my approach for every case that I plan on bonding Bruxer or monolithic zirconia restorations. So this is an interesting case. This patient had a Emax crown placed there on tooth number 30, and it was bonded in place. And immediately after it was bonded, this patient had pressure sensitivity each time he ate. So after a 1.5 years, this patient was actually prepared to go through endodontic therapy until the dental gods dropped a Jolly Rancher, and the Jolly Rancher debonded the restoration. And so the patient, going back to the same dentist using the same cement, same restoration, but the second time around, a desensitizer was used. Gluma was used on the tooth preparation before the same exact cement and the same restoration, and then all of the sensitivity went away. This is actually my crown. I had this crown placed in 2008, and for almost 2 years, I could not eat and chew on my right side. It hurt so much each time I bit down. And of course, we checked the occlusion, we checked the bite, everything was fine. But I'm very grateful that the Jolly Rancher came around and it pulled off the restoration. And it was amazing to me. And that stuck around with me. I never forget that situation. And so because of my own personal experience with this type of restoration, and we know that bonding is very technique sensitive. There's a lot of steps. Sometimes we etch. We're afraid of post-op sensitivity, and that's what happened. Before, in this case, multi-link automix was used from Ivoclar. The A and B primers were applied to the tooth structure. All of the steps were followed properly, but the first time around, I think that the tooth was a bit desiccated. So that is what caused the post-op sensitivity. So I highly recommend if you are experiencing any post-op sensitivity with your restorations, of course you check the occlusion, but I would highly recommend the additional step of putting a desensitizing agent before you bond your restorations in. So let's take a look at a case where we're going to bond in lithium silicate restoration. So these are the glass ceramic materials. So here's our patient, Sam. We're going to take her through some anterior veneers. So if we look at it here, she actually had 4 veneers placed on 7 through 10 to address her concern with she had some spacing and some smaller laterals. But she didn't like the dimensions of her teeth. And I told her, yeah, maybe they're a little bit wider than they are long. So let's see if we add 2 more, we're gonna add in veneers on the canines as well to try to lengthen and create a better symmetry here. So these are the provisionals. We're gonna go ahead and actually remove the provisionals now. I did not seat the provisionals. I usually like to bond those in, a spot etch and bond. But this was actually a next day delivery because I chairside milled these veneers. We prepped her on Thursday and I delivered the veneers the very next day, Friday morning. So whenever you remove your provisionals, it is extremely important to ensure that you remove all of that residual acrylic, any provisional cement, and it's important to check and dry the tooth to see whether or not there's any remaining cement left if you did use any provisional cement. Because oftentimes, even after a good pumice, cleaning of the preparations, there may still be some left over. So ensuring we have a clean surface to cement or bond to will also ensure good success of our restorations. So here we are trying them in similar to the Bruxer process. I'm using Cours NX3 again. They're try-in cement, they're translucent variety, and that just helps us evaluate the overall appearance of those restorations. For these materials, we do have to etch it. In this case, I'm using Ivoclar's product called Monobond Etch and Prime. It contains an acid to etch the glass ceramic, and when you rinse it off, it will leave a layer of silane. So for glass ceramics, we have to etch the ceramic and apply silane, but that Monobond Etch and Prime product is a great product because it combines both of those steps into a single bottle. And we all like to make things easier. On the tooth side, this is going to be exactly the same process that I use for zirconia restorations, a total etch approach, etching with phosphoric acid, and then we rinse off, and I will apply a desensitizer. So I will scrub in Gluma, let that sit and soak in for about a minute. If there is excess desensitizer on the tooth, we will aspirate that with a high-speed suction. And then I immediately apply directly onto it a bonding agent. In this case, I'm using Cours OptiBond Universal. Whenever you apply your bonding agent, you do really want to scrub it into the dentin and apply it to all the bonded surfaces. Here, I'm air drying a little bit. You saw the suction on the incisal edge to help aspirate some of the excess bonding agent. And then now we go ahead and seat the restorations in place, again, using cours NX3. And this is still the light cured variety of their NX3 cement, because that again allows me to seat all the restorations at the same time. If you prefer to do them separately, a lot of clinicians like to do 8 and 9, fully cure, and then take your time and work on the others. That's totally fine too. I just found a good approach using the light cured cement to seat all of them down together. And so here, and using that smaller light cured tip, as I'm holding the restorations down with those bite sticks at the incisal and facial position, the assistant is tack curing on the facial and lingual to tack cure along the margins for ease of removal. I like to tack cure. I've also tried to remove the cement while it's still in the low viscosity gel state, but I prefer to remove it after it's been tack cured. And so here is the final result for our patient. Again, this is the obsidian lithium silicate material. A great result using an adhesive bonding approach to lock these in. And we can get a final look at our patient Sam, the before and after, and I think we have a really nice result there. So a recap of that process. So we take our obsidian or Emax lithium silicate or disilicate material, and on the restoration, again, we do need to ensure that if you are receiving these from the lab, that they've etched them for you. Here at Glidewell, we do etch every Emax, every obsidian restoration before it's sent back to you. And so that's typically done with a hydrofluoric acid in a 5 to 10% concentration. Depending on the type of material, it can be anywhere from 10 to 20 seconds. But on your end, you do need to apply silane. I'm showing there again that product by Avoclar, the Monobond Etch and Prime. And the reason why I both etched and allowed the silane application is because I milled those in the office chair side. So the material out of the mill, obviously it doesn't come out of the mill etched and primed. So that's why I use that single bottle. It's a great product. But otherwise, from the laboratory, if they are etching it for you, after you try it in, then you want to clean the restoration out really well. You can use alcohol to clean the internal surface to remove any contaminants, and then dry it really well, and then apply your silane. The silane needs to just evaporate on the surface. You do not want to rinse that off. Typically, if we are using a separate silane agent, we'll use Monobond Plus, and that will be allowed to react for at least 60 seconds, but you just let that air dry on the material. On the tooth side, it's going to be the exact same thing. Apply the etchant, rinse and dry, make sure the dentin is moist if possible. If not, you do need to ensure that you re-wet the dentin using either a desensitizing agent or a primer or both. It doesn't hurt, and then apply your bonding agent. All right, we're going to finish up with the resin hybrid or composite restorations. These materials have to be air abraded. So what you just saw at the beginning, I'm going to back that up again. Here I'm using a chairside Danville micro etcher. This is 50 micron aluminum oxide. These materials ideally need to be air abraded to create that roughened internal surface, and then a bonding agent or adhesive is applied to the restoration. Once the bonding agent is applied to the material, now we work on the tooth structure. On the tooth structure, it's the same process. So for every bonding situation, I'm going to etch. And in this case, I actually followed a selective etch technique where I simply just etch the enamel. Here I'm applying our Gluma desensitizer. We let that sit and soak in for a minute, aspirate any excess, and then we're going to scrub in our primer and bond. In this case, I'm using Cours OptiBond XTR bonding system. It's a 2-bottle system. It's a primer application and a adhesive. And that ultimately is to create a great hybrid layer for our restoration. And for the cement here, we're using Cours self-adhesive resin cement, Maxim Elite. You can see it can be sometimes a bit more challenging to remove the cement if you let it sit for too long. So if you are trying a new cement, or if you haven't found that right time period to remove the cement, start off with a very short light cure. Start with 1 to 2 seconds and touch it with your Explorer. If it hasn't gelled yet, just quickly apply the light for another second and take it in increments of a second. You don't want to go for too long, otherwise it can be extremely difficult to remove that excess. And so here is that partial coverage situation using a hybrid ceramic material. This is 80% ceramic and 20% resin. And we do need to bond these type of materials in. So a recap of what we just did there. In this case, for the material, I used Glidewell's camouflage. Again, that hybrid resin ceramic. On the restoration, you have to air abrade it. That restoration, I did also mill chairside, so I had to air abrade it on my own using the chairside Danville micro etcher, again with 50 micron aluminum oxide. But if you do prescribe these through your laboratory, check with the lab to make sure that they are air abrading them for you. And again, here at Glidewell, if any of these type of materials are prescribed, then we do air abrade those materials before we send them back. After you try it in, make sure you clean the material off well, and you do have to apply a bonding agent to the internal surface. In this photo example, this is Cours OptiBond XTR, or now it's called OptiBond Extra. This is the number 2 bottle. This is the adhesive. So it's a 2-bottle system, but the primer number 1 is only used on the tooth. So on the tooth, you're going to use 1 and 2, and on the restoration, you would only use the bonding agent. So if you're using a 2-bottle system on these type of materials, or for any system, you do want to just, on the restoration itself, only use number 2. On the tooth structure, you saw I selectively etched, rinse and dry. I always apply a desensitizing agent on all vital teeth, and then we do apply the prime and bond. So I know that was a lot of information. I appreciate your time, and I'll be happy to answer any questions that you may have.